Hello everybody and welcome to Virtual Coffee with an OSCE Educator. My name is Sarah Glenn. I'm the Managing Director of My Healthcare Recruit and owner of the OSCE Accelerator learning programme. And I am joined today by the lovely Beth Vincato. Beth is an OSCE Educator. She's been teaching OSCE for over 5 years now, supporting literally hundreds of nurses, international nurses, to pass their OSCE. So we're delighted that she's joined us. We really wanted to do a little bit of a deep dive today into the glucose monitoring station. We know that the clinical skills stations, we always get questions on our social media, and we just wanted to have a bit more opportunity to speak with Beth about what we can expect in this station and any top tips. So welcome, Beth. Lovely to have you join us. Can we kick off by you telling us a little bit more about the glucose monitoring station and what an international nurse might expect to be presented with for that clinical skills station at the OSCE?
Okay, so hello and welcome to all our viewers. So for this procedure, obviously you're going to have to check a blood sugar and you're going to have to document it. So you're either going to have a mannequin, which is kind of like a hand, and actual blood comes out of it, not fake blood, when you prick it, which you can test.
Halloween style.
I know, it's very interesting, isn't it? Sometimes that they don't have that mannequin available, so that you will actually have to do it on a normal mannequin, and the examiner's just going to tell you the reading for that one.
Okay, wonderful. What kind of time limit is on this one? How long do nurses have at this station?
So it's quite quick, this one. It's 8 minutes, but you know, it's a simple procedure. It's going to take us 2 minutes in real life to do, isn't it? So don't worry.
Wonderful. Any documentation required for this station?
Okay, so for this one, you have just a simple chart, which you just need to write the reading down, so it shouldn't be any problem.
Okay, simple chart, just the blood glucose reading afterwards. Any interventions that you have to write down afterwards, or is it literally just the reading?
No interventions you need to write down afterwards. Obviously, it's a good idea to have to know the normal range, as we should do as nurses anyway. Just be careful. I know particularly with some of the countries, the readings we have here is actually completely different because it's measured in a different units.
Okay.
So please be aware of our readings in England, the scale. So for the normal reading pre-meals, it should be 4 to 7.
4 to 7 pre-meal, and after meal?
Just a little bit higher than that. Okay,
wonderful. And any equipment that is required at this station, what might you expect to be confronted with equipment-wise?
Okay, so you have a simple machine for this one, similar to the ones that we give the patients for their self-monitoring at home. So it's really easy to use. It's not like some of the complicated ones we have sometimes. Also the lancet, which is the thing we use to prick the finger. Mm-hmm. Sometimes they're a little bit different to the ones we normally use in the hospital. So just be aware of different ones that are available. Sometimes they provide you with like a multi-use lancet.
Okay.
You shouldn't be using this one. This is for the patients who are self-managing. Okay, and they place that there as a distraction. You shouldn't be using that. We shouldn't use it as nurses because it's obviously a high risk of infection. It's fine for the patients to use themselves.
So just so I understand, when you're looking at the equipment, they may put in a multi-use lancet as well as a single-use lancet, and it's almost a bit of a trip up. They want you to make sure that you choose the single-use lancet.
Yes, you will notice for maybe some of the other stations that you have additional items and you think, well, what do I do with that? Don't worry, just leave it.
And is it super obvious which one's multi-use and which one is single-use? Is it clearly labelled?
Yes. Yeah, the multi-use is like a pen one, so you won't be using that.
Perfect. Any top tips on how to best prepare for this station and get yourself ready and put yourself in a good position for a pass?
Okay, so as always, get familiar with the machine and the lancet, and be aware of the different units we're using here. That's it, you should be fine. It's quite an easy station.
Wonderful. I know you say it's probably on the easier side. Any, I guess, reasons for common fails or common mistakes?
Yes, so as always, I say it's easy in comparison to the other stations, but nothing is easy with the OSCE. So not disposing of your sharps correctly, obviously try and dispose of them straight away, and not checking the patient's hands are clean, that kind of thing.
Got you. And am I right in thinking that you should use a wet wipe rather than an alcohol wipe to clean the hand, because the alcohol wipe could potentially contaminate the blood glucose result because it's got some glucose in it?
Yes, that's correct. Or you can wash them with soap and water, the patient's hands. In the marking criteria, it does say it's acceptable just to ask the patient if their hands are clean.
Okay.
So to assume they've already washed them.
Wonderful. I guess any final top tips that you haven't mentioned that it would be helpful for someone to know, or do you think you've pretty much covered it?
No, I think just in order to practice this station, try and get a friend with you, have a look at the marking criteria, and they can tick off what you've done and time yourself. And good luck.
Wonderful. Thank you so much for joining us, Beth. Much appreciated. Some really great top tips there, and we look forward to you joining us again next time.
Thank you.